R-Jolad is doing neurosurgery now. We went to this course 2 years ago. We'd never operated on a brain. A cohort of us from different departments were put together to attend this course at EDC around the essentials of healthcare, the structure of it, the regulatory framework, how it's financed, how to move it forward, the strategy behind it, in an effort to sort of create a cohesive leadership group. Was the reason why we ended up taking this course. It was specially put together by Afia Care and EDC for senior leaders and junior managers at R-Jolad Hospital.
After our program with the school, I think a lot of changes has happened, and one of the key areas that I'm very, very happy about is the generation of data. Today, we have very reliable data and tracking templates where we are able to know and break down per specialty the level of productivity and, in fact, in respect to the cost of care. This has helped us a great deal. It has held our clinicians accountable to production. It has also helped us engaging and having that line of sight on where we can improve and what we can improve on.
What was more powerful about the program was the fact that it was being done in a group from R-Jolad, from different parts of the hospital. So it was really good to have those sorts of discussions now being held across the different parts of the hospital. So we're thinking about how to scale and give quality healthcare, and we're also discussing that with our billing and settlement department about how to make sure the care is affordable but also feasible, and at the same time thinking through that with our customer care team about how we can also make sure patients have a good experience.
This session allowed every one of us to be in the same room, the key decision makers, and we were able to see things from this different perspective. So we spoke the same language, whether it was clinical or non-clinical.
Perhaps the content was not novel, but this conglomeration, this group of people was, and that was a really fabulous thing. So I really enjoyed that. I'm super proud of what we've been able to do, and this is my 5th year at R-Jolad. We've had a rapid expansion of the specialties that we're providing. We have now general surgeons, nephrologists, obstetricians and gynecologists, ENT physicians, intensivists, anesthetists, in-house, full-time, working here, in addition to a whole cohort of visiting doctors that provide other services. R-Jolad is doing neurosurgery now. When we went to this course 2 years ago, we'd never operated on a brain. We have a laminar flow theater. We're replacing hips. We're in the process of beginning to think about putting in pacemakers. We're building up our cardiology services. We're becoming a network expander. We're giving people more one-stop shop for everything that you can do.
And one particular area again is the focus on the patient's feedback. We have introduced quite a number of measures, taking our patients' satisfaction and net promoter score from as low as, in fact, in some cases in the negative, to as high as 70% today. That is one area that we're very proud of.
Turning back to some of the academic courses offered at EDC, I would say that it's one of the places where you can start to kind of get this kind of additional training, and it's fundamental. We're going to really see a pivot and a change when the doctors start to take charge of the operations, the nurses, the healthcare managers, the financiers who have this health understanding. And that course at EDC is a very great way to start to begin to understand all those other dynamics that play into healthcare that we need to understand.